Well, joining us now is Nova Scotia Senator Stan Kutcher. He was one of 3 senators who filed a dissenting opinion to the committee's report. Senator, good to see you again. Thank you for joining us.
Nice to see you, and thank you for asking me.
So the Joint Committee, the majority of its members, they say that MAID for individuals with mental illness should not be granted until safety concerns are addressed, until capacity concerns are addressed. They're backed up by provinces and territories. But you don't agree. Are those not valid grounds for a delay?
Well, the committee reported that the medical system in Canada is not ready, but the committee didn't study the medical system in Canada. In fact, what the committee was supposed to study was whether or not the federal government's contribution to preparedness had been achieved. Remember, this is an amendment to the criminal code. It's not a prescription for providing health care. That's the responsibility of the provinces. The committee did not hear from each of the provinces saying they were or weren't ready. In fact, the committee did get briefs from a number of provinces saying that the provinces were ready. The committee suppressed those briefs. So I'm not sure where the information is coming from that all the provinces and territories are saying they're not ready.
You're not sure, although you do in the dissenting opinion say that prejudice and stigma against people with mental disorders is reinforced by the majority recommendation. How exactly does it do that?
Well, what it does, it implies quite clearly that people who have a mental illness are not capable or competent, not able to make decisions about their own bodies, about their own end-of-life care, although all other Canadians are able to do so. The other issue about this is people who have a medical illness and a mental illness are not addressed here in the report, and yet they are able to make those decisions. So this is an issue of equity. This is an issue of charter rights, of a vulnerable group of people having the same charter rights that every other Canadian has to all kinds of health care, regardless of the type of health care.
So how do you close that circle then? If on the one hand you have the charter rights of Canadians, as you say, not being represented in this, up against, say, a province or a jurisdiction that says it's not quite ready, doesn't have the capacity or the training to actually carry through with this, how do you close that circle without delaying it?
It happens all the time in Canada. Not every province provides every kind of health care right now, and provinces are free to provide the kinds of health care that they wish to provide. The federal government issue is an amendment to the criminal code, the same way that the federal government amended the criminal code around contraception. Prior to 1969, for example, it was illegal to have sexual intercourse using contraception for the prevention of pregnancy. That was changed. The same way that the criminal code was amended to allow for same-sex sex. So that before it was a criminal offense to have sex with the same-sex partner. The same way that the criminal code was amended to address women's right to choose. All these things were amendments to the criminal code, which is in the federal government's jurisdiction. The issue of how the provinces choose or don't choose to deliver care, that's their jurisdiction. They will choose how to do that.
So do you think a value judgment came into this process as opposed to just sticking to the mandate?
I don't know what came into this process, but the mandate was clear to the committee, and the committee did not fulfill its mandate. In fact, the federal government had identified 3 criteria in a letter that Minister Duclos wrote in October of 2022 that identified the 3 issues that the federal government had responsibility for in terms of preparedness. The first was a database that addressed the multiple aspects of MAID. That was the responsibility of Health Canada. That is done. The second was a model practice standard for the provinces to assist regulators in each of the provinces that they would be able to bring in the regulations of medical care related to MAID in those provinces. That is done. In fact, we heard from the head of the federal regulatory body that it is ready. And then the third thing was a training program that was to be able to assist people to do a better job in MAID in general, including MAID for soul mental disorder. That is done. And not only that, that program has actually been accredited by the Royal College and by the College of Family Physicians. And that's also done.
Well, at this point, we know that the health minister says he will introduce legislation to delay it, delay the extension one more time. How do you react to that? What's your advice to the government at this point if this is the course that they've decided on?
Well, I would hope that the federal government, regardless of which party is in power in the federal government, follows the charter, and that the issue here is a charter rights issue. And if the committee has done a very poor job, which I think it has, the majority report has done a very poor job in assessing preparedness, that for the federal minister to deny Canadians a charter right on the basis of a faulty majority report in the committee, that's a problem.
Senator Stan Kutcher, I always appreciate the conversation. Thank you for this.
And thank you for taking the time on this important topic.